India has poor record on child health metrics and COVID made it worse. But just as we begin, the data presented here are only those cases that were reported at nearly 2 lakh health institutions, largely rural and public, and some large private health facilities too. Hence, numbers don't reflect the full picture but shows crucial trends. Now, pneumonia, diarrhea, sepsis, malaria, followed by measles are the top childhood killers. Nearly 500,000 pneumonia and diarrhea deaths occur in India annually, and hence tracking these is crucial. Now, here all these diseases have seen a massive drop in registration and reporting. This in no way indicates that children were healthier in FY21, but it shows missed cases. Any underreporting, and in this case it's more than 50%, can lead to severe disease burden and potential deaths. Now, as compared to January 2020, which was a normal month, pneumonia cases fell sharply through 2020 and saw a 80% drop in reporting in May 2021. This was amidst the peak of the second wave. Now, remember, pneumonia is the largest childhood killer and reporting has fallen down sharply. If we talk about vaccine preventable diseases, those that require hospitalization for treatment, here the number of children reaching in hospital fell down sharply. Important to note, however, is that in diphtheria and tuberculosis, reporting rose in urban centers, highlighting unavailable facilities in rural areas and people forced to travel to urban centers. On measles, cases reporting fell, so did the reporting for deaths in the age of 1 to 5 years. These children didn't come to the institutions. They either got no treatment or were treated at home. Deaths in these instances will go up, and that is possibly reflective here in the urban centers with a 267% rise. But since this data is only those that get reported in hospitals, the data will be much lesser than the civil death registry. That will show a complete picture. On diarrhea cases saw significant reduction in reporting through 2020, largely in rural areas, but both in urban and rural. Diarrhea is the second largest childhood killer in India and needs immediate attention, especially in rural areas where health and hygiene awareness is poor. Now, even though when you compare a year-on-year picture, you see a drop in cases and diarrhea deaths, urban centers sees a sharp rise in deaths being reported both in the infant as well as under 5 category, showing that in rural there was lesser access to health care. Now, if we look at the COVID lockdown months of April and May in 2021 versus the normal year of 2019, diarrhea deaths have actually gone up. They've shot up during the COVID second wave. Now, this is truly a horrifying picture. Worsening malnutrition through the lockdown year of 2020 may have had an adverse bearing on diarrhea, based also on a lower base of reporting. And we already know that malnutrition is the biggest underlying factor pulling down children's health. And over here also we saw a sharp decrease in reporting of cases as well as the severe ones that required hospitalization, more than 50%. These children did not receive any support and their condition could have deteriorated. It is also important to note that more than 60% of deaths that occur in the under 5 category is attributable to some form of maternal and child malnutrition. Now, latest health survey data also shows that over a quarter of children were already stunted in 2019-20, and the last year of access to healthcare and access to food in many instances has certainly wiped out whatever gains we made in previous years. National Nutrition Mission's target of reducing child undernutrition by at least 2% per annum seems to be completely lost.